Of us can feel an emotional shift this time of year. We're talking about seasonal affective disorder, and to learn all about it, we're chatting with Catherine Bays with Blue Ridge Behavioral Healthcare. So welcome to the show.
Yeah, thanks for having me.
Absolutely. So when people hear about seasonal affective disorder, it's also known as SAD. What is this exactly?
Yeah, so great question. So it really is how it sounds. It's a disorder that you feel, sad or not like yourself really for different seasons of the year. It usually happens whenever we transition from the spring and summer months into those fall and winter months. You'll notice different, you're just not feeling like yourself. Things like lack of motivation or energy to do things, just not being able to get into and accomplish your daily routine. And typically what will happen is you'll feel some intense symptoms for the fall and winter months, and then we transition back into spring, and then all of a sudden you're starting to say, hey, I'm feeling a little bit better. You're not changing anything about your routine, but you're noticing that you're feeling better. And that'll typically happen you'll start to notice a couple of years. Around the same time it happens, you'll start to feel these symptoms. Symptoms like lack of motivation and energy, like I said, changes in your appetite, typically overeating. You'll see changes in your sleep patterns, like you're wanting to oversleep. Social withdrawal, that's a big key factor with this, with seasonal affective disorder, SAD. And really wanting to isolate, not really wanting to get out and go interact and do the things that you normally do.
Yeah, so it's a whole entire shift kind of in demeanor for just one particular time of year. I think another question people might be asking themselves, though, is how do I know if this is seasonal or if this is something else going on? Are there differences that we should be aware of for this time of year?
Yeah, great question. So one of the key components with seasonal affective disorder is that it'll happen around the same time every year. You'll notice the symptoms start to occur maybe when the days are getting shorter, the sunlight's getting shorter, I should say. And you'll notice that once the next season comes around, you're starting to feel better. Whereas other disorders like depression or anxiety are pretty year-long. You don't really see a lot of reprieve from those.
Yeah, there's never kind of an uplift with that feeling. So is there treatment for SAD? Is there a treatment that people can kind of do in their own daily routine, or a way they can reach out for help?
Yeah, definitely. Daily routine, just making sure that you're being very intentional about what you're doing every day, making sure that you're reaching out to your social networks, doing activities that require interacting with others, so you kind of get out of that isolation period. There is a couple of different therapy options, light therapy that you can kind of do on your own. It's literally as it sounds. It is a box of light that kind of reflects onto you. You sit in front of it for about 30 to 45 minutes a day, and you get all the benefits that you would from being out in the sunlight and having that interaction outside. Obviously, counseling. I'm a counselor. I fully believe that everyone would benefit from seeing a counselor. But they can use evidence-based practices to help you understand what you're going through and what those symptoms look like, and skills to help with them. Some other options might be talking with your doctor about an antidepressant medication. If it comes to that. Along the same lines as talking with your doctor, everyone that's been to the doctor has heard the doctor say, eat your fruits and vegetables and make sure to exercise, but it's been scientifically proven to help with feelings of sadness or depression, especially seasonal affective disorder. They say about 3 to 5 days a week, 30 to 45 minutes of aerobic exercise, and really eating foods that are going to help to increase your production of certain chemicals in your brain that make you feel good, like fish and nuts and seeds and even pineapple. Even tofu. So
it's kind of finding that purpose, and of course fueling your body to be the healthiest and essentially best it can be, both brain and physically. So it's nice to hear that there is a solution to this, because a lot of times when people are in those darker spots, it's hard to realize, hey, there is a way to get out of this as well.
Yeah, and I think that that's such a key to know, that when I'm feeling off, when I'm not feeling like myself, it doesn't mean that that's how I have to feel. There are options, and really the key point is mental health is a priority.
Yes, absolutely. Catherine, I appreciate it so much. And of course, if people are looking to maybe get more information, reach out for help. There are some resources that we can show you guys on the screen as well. Different places for people to find counselors, but also maybe learn more about SAD.
Yeah, definitely. So psychologytoday.com is a great way to find a local counselor, even a telehealth counselor. You can call the number on the back of your insurance card. They can give you information on which counseling or doctors would be approved. And of course, Blue Ridge Behavioral Health Care, we're open for intakes every day.
Yeah, and you guys are a great resource for our community. Well, Catherine, thank you so much for explaining more about SAD to us, and I hope you have a great rest of your day.
Thank you.
Absolutely. All right, stay with us here at